Patients often ask, why don't adjustments hold forever? Why does one person hold a correction longer and another person's unstable at the beginning? So here's the atlas. There's a joint here, and where it fits to the head, there's two joints on the bottom of the head that fit like mirror images. Every joint in the body, where they fit together, there's a very fibrous ligament around its border called a joint capsule, and that's what gives a joint integrity. So when there's a concussion of forces, whether it's a whiplash injury, or you get dropped on your head wrestling, or you slip and fall on the ice and bounce your head off the asphalt or concrete, that type of force can dislodge the joint. It tears the joint capsule, it gets locked there, and then usually by the time the patient comes into one of our offices, it's been 2 to 50 years, and the ligament actually heals up in that bad position. Now, healthy collagen has what they call laminar or parallel fibers, and it's a certain type of collagen. When the ligament gets torn, it heals in what they call cross fibers, and it's a different type of collagen that's not as strong. So when we get the vertebra corrected, depending on how much injury is in that joint and how much elasticity is in the ligament, can play a role in how stable they are at the beginning. Now, over time of that joint being misaligned and getting it back in motion, that ligament will heal, mend, and repair. The muscles that have been out of balance through the spine will come back into balance. But ligaments take a long time to repair because they don't have a lot of blood supply. So it can take 12 to 24 months for a ligament to heal and repair. And again, when it does heal and repair, it does it with a weaker type of collagen. So there's always kind of an inherent weakness in their long term. But in the short term, the patient who is a little unstable, it's because they have a lot of ligament damage and soft tissue damage. And there's other factors that play a role, like how much stress is in their life, how good is your upper cervical doctor, and how good of a correction does it get? What are you doing following the correction? Do you go and play golf right afterwards? Do you sleep on a crappy pillow with your head turned at an angle? So there are things that the patient can do, but by and large, patients who are unstable at the beginning has mostly to do with laxity in the soft tissue and the ligaments, which again takes time to repair.